You've been feeling in the last 24 hours?
Like very, very tired.
Yeah.
Hoarse.
Hoarse voice?
Hoarse voice.
Sore throat?
Not sore throat, but kind of scratchy and a lot of coughing, very dry.
Okay, if you could pronate and externally rotate your arm for me, perfect. Then we have this vibratory tool which helps to distract the superficial nerve fibers. Keep your arm straight, externally pronate. All right, tiny poke. You okay?
Mm-hmm.
Perfect. And flushing, you shouldn't really feel much, but before I flush, I'm gonna...
We should have taken the blood work, huh?
That's okay. So I'm just securing the IV, taping it down. He doesn't have any discomfort. It was a comfortable placement. That was very comfortable, you said, right?
The insertion of the IV needle was not really much of an event at all. I don't feel it. It's
Great.
secure. I mean,
We want it to be painless for you. So the first thing I'm doing is I'm just gonna hang the IV bag to start of the IV, which is really just prepping the tubing. So we're just opening the tubing, attaching it to our saline bag, undoing the packaging. Everything is a sterile package, so we like to make our IVs the moment as we personalize it for our patients. Same day, you put the IV wiring, or we call it the tubing, into the bag. And we just prep the line to make sure that there's no air within our line. And as we see it dripping, medication bottles, as I start to draw from them. And it's a fairly simple process. Since he's not feeling well, the amount of vitamins I'm going to put into the IV. And for our performance and recovery, we can put 3 milliliters of each of these products. And I'll just go up on the vitamin C for him. So we're starting with the mineral blend. I'm going to draw 3 milliliters of this product. And that's it. We kind of emptied this product out. This is one of our best-selling IVs. So we will take and clean this, and I will insert the mineral blend into the actual bag. Now we will do our vitamin C. Each milliliter is about 500 milligrams. So for him, I'm going to give him a boost of vitamin C. So we'll give him about 3 mLs, which will be about 1,500. And then I'll put another 500. So we'll give him 2,000 milligrams or 2 grams. So that's 3. I'm going to give him another ml. I think as we have more education on nutritional guidance and supplementation, people are more aware of the value of getting IVs. I think as trendy as things can be, they're still beneficial for your health. I provide a lot of nutritional and supplementation support through IVs. I think, yes, it can be trendy, like after a hangover, but it's a great way to bypass the gut barrier and provide nutrition cellularly. So as trendy as it is, it's still very beneficial for your health, depending on the different cocktails you get, because you can fully absorb this into the venous circulation and into the cells and bypass any type of barrier that your gut could create in terms of absorption. So there's very little variability when you're putting it directly into the vessel. And we have created our IV. We are also going to give him an NAD flush. So he's going to run his IV and some glutathione, which is going to act as an antioxidant for him. The Vita complex is actually a little bit yellow. The B vitamins have a yellowish tint to them, so when we add that in, it turns the bag yellow. And attach this to a pressure bag so that we could make this a lunchtime IV for him and quickly get him in and out of the office. It'll take about 15 to 20 minutes to run a full liter for him. He's going to start feeling very hydrated. Over the course of the day, not anything immediate, but over the course of the day, feel a little bit more energized and revitalized, and his immune system will get a boost. You could do it once a week, depending on your deficiencies and what you need, but the powers of the IV and the benefits of it are long-lasting, so it's not just in that moment, it'll last for the rest of the month for him as you boost the immune system and provide support. Everyone's deficiencies are different, and everyone's immune system is different, and gut barrier is different, so I think the benefits of coming and getting tested and getting a tailored IV to what your deficiencies are will help. Not everybody needs a tremendous amount of vitamin C or B12, especially if you're getting it nutritionally. So it's important to get tested what you need, but we are traditionally very B vitamin deplete as human beings and magnesium deplete. So you really can't overdo that because a lot of biochemical processes in the body require those vitamins. So it will overall be beneficial for anyone and everyone. Okay. So here I am pressuring this bag. How are you feeling?
I feel okay.
Does it feel a little cold running through?
I don't feel anything right now.
Great. So as you can see, the rate of dripping is quicker, which means he's getting this directly into his vein. And that's that. Sometimes just pushing vitamins into it, you can taste it sometimes.
Yes, that's
normal.
Yeah, it tastes the B
The
vitamins.
B vitamins.
Actually,
Yeah.
The reason I decided to try IV therapy was really just got to a point in my career where I was exhausted, like all the time. You know, I have been a trial attorney now for 17 years, and it's very taxing physically and mentally. And so IV therapy has done a few different things. First, it actually forces you to sit down, you know, and actually take a rest. And then while you're doing that, you can feel the benefits of just being hydrated. Sometimes you just can't drink enough water throughout the day, you know, because you're going so fast and you just feel depleted. So being able to hydrate and then get an infusion of, you know, vitamins and minerals right into your system really helps give you a nice recharge and refresh. The first thing you feel is hydrated, which in and of itself is a great feeling. And, you know, within, you know, 30, 40, 50 minutes, you'll really start to feel a little bit more pep in your step, a little more energized, a little more clarity mentally. Those are really the most immediate things. Depending on the package that you get, or the infusion, I should say, is how you know, in the days following, you know, that some of the benefits of getting IV therapy, putting more nutrients into your body, you know, directly, you know, into your bloodstream, just gives you the opportunity to stay a little more energized for an extended period of time. You know, what you get, I mean, if you just sat down and got hydrated, it's gonna, you know, last you, you know, help you stay hydrated for, you know, a couple of days. But with the vitamin and the NADs, you know, those infusions will last for days and weeks, and just basically helping you keep your immune system up. I mean, the more functional your immune system is, the greater the benefit you're going to get, you know, long term. And IV therapy offers really the quickest way to give your body what it needs, especially when it needs it. I recommend any high-functioning professional, any busy professional, to consider IV therapy. It's something that I have incorporated into my self-care regimen, because when you are operating at a level of very high stress, not to mention your personal obligations with family and children, things of that nature, giving yourself the opportunity to give your body what it needs directly into your bloodstream and forcing you to sit and rest while you do it is really the perfect combination to keep you functioning at a high level.
Do you have any questions? Reach out to us. We're happy to help, and don't forget to follow us at Dr. Stay Young.